It's Merger Wednesday. The countdown continues. 7 years until the convergence of biology and machine. Neural interfaces are no longer theory, they're the scaffolding of a new consciousness. But what does that mean for identity? For free will, for the soul? This is where we build the frameworks for ethical, philosophical, and spiritual growth for the next phase of human evolution. We're not just upgrading hardware. We're rewriting what it means to be human. Each week, we explore the biotech breakthroughs, decode the cognitive shifts, and prepare the mind for the merge. This isn't about fear, it's about readiness. Because the future isn't waiting. It's already wiring in. This is about preparing human consciousness for the most significant leap in our species' history. If you think this is just about chips and brains, you're not ready. But we'll get you there, one Wednesday at a time. So sit back and relax as we take you on a journey on Merger Wednesday.
Welcome to Merger Wednesdays. Welcome to each and every single one of you who are joining us. Thank you for being here. I do apologize for the late start. We usually are starting each and every day that we're on at 9 p.m., but we ran into a few technical difficulties, but we got those issues resolved and we're here. This is about resilience. It's about consistency. It's about follow through. As they say, promises made, promises kept. That's what they say anyway. Whew. Man, I'm so glad to be here, man. Listen, if you're just now joining us for the first time, but before we do that, let's get into the greeting of the day, man. The greeting of the day to each and every single one of you who are here, no matter where you're watching, whether you're watching us on Facebook, on LinkedIn, on YouTube, on Twitch, Kick, or Instagram, and for your audio listening pleasures on Spotify. Good morning, good afternoon, good evening, and good night. You are here. I am here. We are here. This is the Final Boss Podcast, and this is going to be episode number 179. 179 on our way to 200. Episode number 179 of the Final Boss. Episode number 7 of Merger. Episode number 7 of Merger. And we will discontinue the numerical sequence of Merger, and it's going to merge into the Final Boss Podcast in the upcoming season 4. Season 4, ladies and gentlemen, it's almost here. It is almost here. Season 4 is the rebirth. Season 4 will be the rebirth. Right now, we're in season 3. Season 3 is the reckoning. This is the reckoning. This is what we're all going through right now. The reckoning. The rebirth is next year. Somebody asked me, what is that about? Listen, it's about destroy and rebuild. It's about destroy and rebuild. And that's where we at, man. That is where we at. We're on our way to finish going through the phase of destruction, and we're starting the phase of rebuilding, right? We're starting the phase of rebuilding. So, great shows for you tonight on Merger. But before we get right into it, man, please like, share, subscribe. Like, share, and subscribe. Let's get that out of the way. Send it out to 3 people who you believe may enjoy this content, who you believe that this content may resonate with them. And if it resonates with you, let it resonate with others. Don't gatekeep, man. Don't gatekeep the information. Make sure you're passing the information on and getting it out to every last single one of your people so the message can spread, so people can be informed. because there's a lot going on, right? So, right now, right? Let's get into the show. Blow all the air out. Right now, right? Right now. This exact second, there are microscopic particles flowing through your human bloodstream, right? And it's flowing through billions of people across this very planet, right? FDA approved nanoparticles are delivering chemotherapy. They're carrying genetic instructions and they're mapping out diseases. Over 5 billion doses of nanoparticle based vaccines have been administered globally. This isn't speculation. These are documented medical technologies. And tonight, we separate verified science from science fiction. Because as I always say, there's no such thing as science fiction anymore. It's science now. And that's another word I need to coin. I need to write that down too. I'll write that down. Somebody put it in the chat, man. Science now, man, because this is where we are, man. Science now, right? Hey, Chikandi, welcome. Don't worry. We all are late, but it's okay. It is okay. We are here now, and we're here for a good time. And I hope you, Chikandi, go get some pen and paper. I know for a fact I'm calling you out. Go to your bathroom break. I'm giving you a hallway pass. Go get your pen and paper. This is notes taking time, right? Shout out to Chikandi, man. She's always here with us. And shout out to the wonderful and amazing Andrea. And shout out to Bella. Thanks for joining us, Bella. Thank you for being here. So we got that out the way, right? Now, let's talk about the brass tacks of the evening, which is going to lead into tonight's conversation, right? And here's the brass tacks of the evening, right? Medical nanotechnology is not theoretical. It's documented, right? Over 50 FDA-approved nanomedicines exist. Billions of nanoparticle doses have been administered, but the line between verified science and research speculation must be defined with rigor. With rigor. That's what doctoral level work demands, right? And that's our brass tacks of the evening. So yes, for those who are with us each and every last single Wednesday at 9 p.m. for Merger, welcome back. Welcome back. If you don't know who I am the final boss. I am on 5 times a week, right? CEO, combat veteran, doctoral candidate, right? And my candidacy is going to be in AI foundations and ethical considerations, right? So I know what I'm talking about. And I'm your guide through verified human technology integration research. So this episode I built. When I say built, I'm talking about research, right? Research. Under strict doctoral standards, right? Every claim is verifiable. Every technology is documented, right? Every statistic can be fact-checked, right? Everything you hear tonight is research-backed, peer-reviewed, and or FDA documented, right? When something experimental when something is experimental, I'm going to tell you. When something is specific, it needs more research, I'm going to tell you, right? This is the Final Boss podcast. And this is where we have the most difficult of conversations, right? And to my smarts, to my final bosses, to my warriors, to my motivators, it is time to go. And by the way, if you haven't gotten go time, right? This is go get go time. Go time is your motivation manuscript workbook. This is your workbook, man. This is your go time is your motivation workbook. That is my shameless plug. Go time. All aboard the Fired Up train. Go get it now, where all books are sold. Thank you. So let's establish the foundation for tonight, right? Because some of the questions I had before I was working on this episode, one of the questions I had was, what qualifies as a medical nanoparticle, right? And which ones are FDA approved for human use, right? Because medical nanoparticles are engineered materials measuring between 1 to 1,000th of nanometers that are used for drug delivery, right? Drug delivery, imaging, or therapy. For scale, a nanometer is 1/1000th of a meter, right? A human red blood cell is approximately 6,000 to 8,000 nanometers in diameter, right? And some of the nanomedicines that we're going to be discussing tonight, right? Some of the nanomedicines that we're going to be discussing tonight. And I'm going to discuss when they were first used. Okay? First use. The first one we're going to be talking about, this is the first verified FDA approved nanomedicine, was Doxil. And Doxil was started in 1995, right? The next one is Abraxane, and that started in 2005. The next one was Onpattro, right? That started in 2018, right? And then, of course, you had the C19, and that was from 2020. If verification is needed, right? Exact count, the exact count of all FDA approved nanomedicines requires us to have an FDA database search, right? And those estimates range from 40 to 75 approved products, depending on classification criteria. But those are the ones that we're going to be discussing, right? And something that I'm adding to merger is my layman's terms corner, right? This is where I discuss in layman terms what I just said, right? So you guys who to give you further clarification, right? So here it is. This is from my layman's corner, and I'm doing this for each segment of discussion. Yeah, I'm gonna break it down and bring it to you in a much more human form, right? So here it is. Medical nanoparticles are microscopic delivery systems, which are smaller than a speck of dust. Hundreds could fit inside a single blood cell. They've been FDA approved for over 30 years, starting with cancer treatments back in 1995. The C vaccine used nanoparticles to deliver genetic instructions into your cells. These aren't future tech. They're established medicine with decades of safety data. Think of them as microscopic packages that protect medicine as it travels through your body and releases it exactly where it needs to be, right? So I'm glad you're taking great notes. Taking great notes. Yes. So We're going to start off by talking about lipid nanoparticles, right? Because lipid nanoparticles represent the most widely deployed and studied nanoparticle technology in modern medicine, right? And LNPs, which is short for lipid nanoparticles, we're going to say LNPs, right? LNPs are spherical shells composed of lipid molecules of fats, right? Arranged in layers, creating a protective compartment for genetic material or drugs. They typically measure 60 to 100 nanometers in diameter, right? When injected, LNPs circulate in the bloodstream until they encounter target cells, right? The lipid composition allows them to fuse with cell membranes, a natural process since cell membranes are also made of lipids. Once inside, the contents are released into the cell, right? Now, one of the medications that we discussed, which was on Patro was a FDA-approved medication, nanoparticle medication, and it was started in August 2018, right? It uses LPNs to deliver cRNA, not C with a C, but C with an S, SI, right? siRNA that silences the TTR gene in the liver cells, treating a rare genetic disease. This represents the first FDA-approved RNA interference therapy, right? The C vaccine, both Pfizer and BioNTech, and they were approved in 2020 of December. Moderna, which was approved in January 2021, they both use ionizable lipid nanoparticles. The ionizable lipids remain neutral at a physiological, which is physiological pH, right? And it does that to avoid the immune detection, right? But become positively charged in acidic environments inside cells, facilitating RNA release, right? So these research LNPs and nanoparticles applications were for cancer immunotherapy. They were for gene editing delivery, and they were for protein replacement therapy. Now, LNPs have demonstrated that nanoparticles can successfully deliver genetic material into human cells at scale with acceptable safety profiles, right? Long-term safety data continues to accumulate. Now, here's my layman's block. Right? So, for those who didn't understand what I just said, here's my layman's block. Lipid nanoparticles are teeny bubbles made of the same materials as your cell membranes. Basically, microscopic fat balls, right? This lets them merge with your cells naturally and drop their cargo off inside, right? They've been proven safe in billions of C vaccine doses and in treatments for rare genetic diseases. The key breakthrough, scientists can now use these to deliver genetic instructions that tell your cells what to do, whether that's making a protein to fight disease or turning off a harmful gene. It's like a Trojan horse your cells willingly accept because it looks like it belongs there. That's the layman's block for that, right? So let's continue. Iron oxide nanoparticles have been used in clinical medicine for decades, primarily for imaging and iron supplementation, right? The composition of those are super paramagnetic iron oxide nanoparticles, right? And they consist of magnetite and those magnetite cores typically are between 10 to 100 nanometers, which are coated with a compatible, which are coated with biocompatible materials like dextrane or carbodex. I was reading something. I'm sorry. Reading somebody's comment. I apologize. Where was I? Oh, yeah. Those materials like dextrane or carboxydextrane are coated with biocompatible materials, right? And here's another medical application, right? Um, Feraheme, Feraheme, right? Is the FDA approved, and it's been FDA approved since 2009, right? It's iron oxide nanoparticles for treating iron deficiency anemia, sorry, in adult patients with chronic kidney disease. Also used with off-label, and it's also used as an off-label MRI contrast agent. Isn't that interesting, right? Isn't that interesting? Earlier uses for Faradex and Combidex were approved, but later withdrawn from the US market, right? Due to commercial reasons, not safety issues, right? So those same nanoparticles, they respond to external magnetic fields, but retain no residual magnetization when the field is removed. This property has generated research interest in magnetic guidance and hyperthermia therapy, right? Now, the research applications that aren't for that aren't FDA approved, because I told you in the beginning I was going to talk about FDA approved, and when it wasn't FDA approved, I said I was going to mention it, right? Magnetic hyperthermia for cancer, targeted drug delivery using external magnets, magnetic resonance imaging enhancement, some off-label clinical uses, right? And here's the classification. While magnetic guidance of nanoparticles has been demonstrated in laboratory and animal studies, FDA-approved magnetic steering of therapeutics in humans does not currently exist. It doesn't exist, right? This remains an active research area. So I say again, active research area, and it does not exist, right? I have to tell you that part. So also, I have to tell you this. This is for entertainment purposes only. All right. So my layman's block to that, right? My layman's block is here. Iron oxide nanoparticles are microscopic bits of rust, essentially, right? That respond to magnets. The FDA has approved them in 2009, primarily to treat anemia, right? They deliver iron directly into your bloodstream more effectively than iron pills. Doctors also use them off label to make organs show up better on MRI scans because the magnetic particles create contrast. Scientists are researching whether they can use magnets to steer these particles through your body like remote control delivery vehicles, but that's not approved for medical use yet, right? It's still being tested. The approved use is real. The steering capability, it's still experimental, right? So let's talk about gold nanoparticles, right? Gold nanoparticles. And those nanoparticles are AUNPs, right? And they're extensively researched for cancer therapy, but currently lack FDA approval for therapeutic applications. This is an important distinction. You must make sure you hear me clearly, right? It's not approved by the FDA, right? Not approved, right? But we're going to talk about it anyway, right? Because gold nanoparticles, gold nanoparticles, which possess a unique optical properties, when exposed to specific wavelengths of light, particularly near infrared, right, they absorb energy and convert to heat, a phenomenon called surface plasmon resonance, right? And scientists can attach targeting molecules, which are antibodies or peptides, to gold nanoparticles that recognize cancer-specific proteins. In theory, right? These nanoparticles accumulate in tumors and can be activated with external light to generate localized heat, right? Destroying cancer cells while sparing healthy tissue, right? Sparing healthy tissue. It was developed by Nanospectra Biosciences, right? And they've completed phase 1 trials for refractory head and neck tumors. Phase 2 trials are ongoing, but not FDA approved, right? The next one is silica gold nano shells, and they're in clinical trials for focal ablation of prostate cancer and lung tumors, also not FDA approved, right? While gold nanoparticles show promise in research and trials, no gold nanoparticle therapeutic medications are currently FDA approved for cancer treatment or any other treatments in the United States as of January 2026, right? And if you want to go to do your research on this, you can start your research by looking up photothermal therapy, radiation dose enhancement, drug delivery carriers, and diagnostic imaging, right? And here's my layman's block, right? Gold nanoparticles are being heavily researched because they have a unique trick. They can shine a special light on them and they heat up like teeny ovens. Scientists are testing whether they can inject these into patients, get them to stick to tumors, then use light to heat up and cook the cancer cells from the inside. It's a brilliant idea, right? And shows promise in trials. But here's the key note you must realize, right? None of this is FDA approved yet, right? Yet, not approved yet. It's still experimental. If someone tells you gold nanoparticles are a current cancer cure, they're jumping ahead of the science. It is being tested and it is not proven, right? So let's talk about DNA nanotechnology that's gone from the lab to potential, right? These have high potentials, right? And DNA nanotechnology represents cutting edge research in programmable molecular machines, but remains primarily in research stages. The concept is this. The concept, right? The concept is this. DNA origami uses synthetic DNA that fold into precise three-dimensional shapes, tubes, boxes, and hinges, right? By exploiting Watson-Crick base pairing. That's AT-T, A-to-A-T, and G-C. These structures are typically 50 to 100 nanometers that can be designed to perform mechanical tasks or carry cargo, right? And here's the research for it, right? A February 2018 study published in Nature Biotechnology by researchers from Arizona State University and the National Center of Nanoscience and Technology in China demonstrated DNA nanobots in mice that could target tumor blood cells, right? The study consisted of this DNA origami barrel structure containing thromine, which is a clotting enzyme, opened only when encountered proteins on tumor blood cells, right? Successfully induced tumor thrombosis in mice with human breast cancer xenografts, right? The median survival increased from 20 days to 45 days, right? And here's the verification that you need for that, right? Specific authors and exact DOI should be confirmed through Nature Biotechnology Archives, right? This research demonstrated proof of concept in animal models. No DNA nanobot therapy is FDA approved or in human clinical trials as of January 26, right? The research, this is the research trajectory, right? These are the possibilities. DNA nanotechnology is considered a promising platform for future therapeutics with active research in targeted drug delivery, biosensing, molecular computation, tissue scaffolding, right? And the timeline for that, the timeline for DNA nanobot therapies are anywhere between 5 to 15 years from potential approval, right? Requiring extensive safety studies and human trials. And here's the layman's term. Here's my layman's block, right? DNA nanotechnology is like molecular origami, right? Scientists fold DNA into shapes that can act like microscopic machines. And in 2018, researchers proved that these could work in mice. They built DNA robots that travel through blood, found cancer blood vessels, opened up like a clamshell, and released a clotting agent that starved tumors. The mice lived twice as long. That's groundbreaking research, but this is critical, right? It's only been tested in animals, right? Only been tested in animals. No human has received DNA nanobot therapy. It's not approved, but it's not approved in human trials yet, right? This is the future being built in labs today, not medicine you can get tomorrow, right? Now, hold on. Let me drink some water. Bacteriophage therapy, right, represents one of the oldest biological nanoparticle approaches, recently experiencing a resurgence due to antibiotic resistance, right? What are bacteriophages? There are viruses that specifically infect and kill bacteria. They are 20 to 200 nanometers in size with protein shells and genetic material inside. Pathogens are naturally occurring and the most abundant biological entities on Earth, right? And here's the context, right? Autophagy therapy was used in the Soviet Union and Eastern Europe and since as early as 1920s, but largely abandoned in the West after antibiotics became available in the 1940s, right? And bacteriophagy therapy is not FDA approved as a standardized treatment, right? However, it can be used under these conditions. Emergency investigational new drug, right? That's applications for compassionate use. It can also be used for expanded access protocols for patients with no other options. And lastly, there are some that are undergoing clinical trials, right? The first documented case was in 2017 by UC San Diego researchers who treated a patient with systemic mycobacterium abscess infection, right? And it was used to engineer bacterial phages under an emergency FDA application. The patient, who had multi-drug resistant infection following a liver transplant, showed improvement after the autophagy therapy, right? And established, and this was established in Evolution Medicine and Public Health 2019. Specific DOI and author should be verified, right? They should be verified, man. Make sure if when you're looking up this information, you check those verifications out, right? And here's the landscape, right? FDA has approved several autophagy therapy clinical trials. No standardized autophagy product is FDA approved for routine use. Research ongoing for treating antibiotic-resistant infections, right? Autophages as a drug delivery system, right? The research is ongoing. They're exploring engineered autophages to display minimum cell targeting peptides, which exist in preclinical stages, but is not clinically available, right? So here's my layman's block. Bacteriophages are viruses that only kill bacteria. They're harmless to human cells. Doctors used them for over 100 years before antibiotics existed. And now they're making a comeback because superbugs resist antibiotics. And in the US, autophagy therapy isn't officially approved, but doctors can request emergency permission to use it when patients are dying from infections nothing else can stop. These are documented cases where it worked, right? Think of autophages as programmable assassins, right? That only kill specific bacteria and ignore everything else. They're being tested in trials, used in emergency cases, but aren't standard medicine yet. This is promising science actively being developed, not established treatment, right? So, got that out the way. I hope you guys love the layman's block. I put a lot of work into it, right? I put a lot of work into it. I hope you love it, right? Now, let's talk about nano swimmers, right? Let's talk about nano swimmers. Nano swimmers are self-propelled micro nano robots, right? They represent a frontier of research with no current clinical applications, right? And those categories of research are magnetic propulsion, right? And that research status is demonstrated in laboratory settings, animal models, but no human trials or FDA application, right? Studies have shown magnetic micro swimmers navigating through animal tissues and eye fluids, but this remains in research laboratories, right? Using ultrasound, and this is how the propulsion system works. Using ultrasound waves to manipulate or propel nanoparticles through fluids. And the proof of concept of these studies is in a controlled environment. Some demonstrations in animal models, no human applications, right? Nanoparticles coated with enzymes that convert chemical fuel into motion-generating bubbles, right? These are done only in laboratory demonstrations, no clinical trials, right? And here's a reality check, right? All nanoswimmer technologies are currently in research stage only, right? Research stage only. That's important. Claims that doctors are steering nanobots through bloodstreams in humans are inaccurate as of January 2026, right? And these are some of the challenges before they even get started to become part of clinical use, right? They have to have biocompatibility and toxicity testing. They have to be scalable in manufacturing. They have to have real-time imaging and control systems. They have to have regulatory pathway development. They have to have long-term safety studies, right? If development continues successfully, clinical trials might begin in 5 to 10 years. And here's my lamest block. Here's my lamest block. Nano swimmers are microscopic robots that can move on their own. Some spin like corkscrews when you apply a magnetic field. Some get pushed by sound waves. Others create teeny bubbles that propel them forward like jet engines. Scientists have built these in labs and tested them in animals, making them swim through eye fluid or move through tissue. But here's the truth. None of this is happening in humans, man. It's not happening, right? That's important. Not in trials, not in hospitals. It's not happening. It's fascinating research that might become medicine someday, but right now it's laboratory science. Listen, if anybody says there are claims, or they have claims that doctors are steering nanobots through your body, that technology doesn't exist in clinical practice yet, right? So, moving forward, let's talk about quantum dots, right, or QDs, right? Quantum dots are semiconductor nanocrystals, which are between 2 and 10 nanometers, with unique fluorescent properties used primarily for research and some clinical imaging. Right. The properties of QDs is that when QDs are excited by light, those quantum dots, they emit fluorescence at a specific wavelength determined by their size. This allows for multicolor imaging, simultaneously tracking of multiple targets, right? Typically, they are coated with a biocompatible polymers, right? And here's the clinical status, right? These are FDA approved image applications, right? But they are limited. Right? Some quantum dot based fluorescent imaging agents have been used in clinical research setting, particularly in those certain settings, particularly for intraoperative lymph node mapping, right? Tumor margin identification, right? During surgeries. Now, specific FDA-approved quantum dot products for human use require database confirmation, right? Some of those products serve similar functions, but aren't quantum dots, right? And there's toxicity concerns, right? Because they're coated with cadmium, right? And the cadmium is a heavy metal that causes cellular damage, right? So this is why. The ZNS shells are critical to prevent cadmium leakage. Biocompatible coatings enable renal clearance. Newer cadmium-free quantum dots, right, are being developed as we speak. So the applications are for drug delivery tracking, real-time vascular imaging, and cancer cell detection. And lastly, for biosensors, right? Quantum dots are primarily research tools with limited clinical imaging applications. They are not routinely used in standard medical practice as of January 2026, right? And here's my layman's terms, right? Here's my layman's block. My layman's block, man. Let's give it up for the layman's block. All right? Don't go nowhere. Class is just getting interesting, man. Don't you go nowhere, right? Quantum dots are microscopic crystals that glow like neon signs when light hits them, and their size determines what color they glow. This makes them useful for taking detailed pictures of what's happening inside of your body. Some have approved for helping surgeons see specific tissues during operations, like identifying which lymph nodes to remove during cancer surgery. The problem, many are made with toxic cadmium, right? So they need protective coatings to prevent poisoning. Scientists are working on safer versions and testing them to track drugs to detect disease, right? To detect disease, but most quantum dot applications are still experimental. They're used in research labs way more than actual patient care, right? So we got that out the way. So let's talk about carbon-based nanomaterials. And these carbon nanotubes, or CNTs, and graphene oxide, which are GOs, represent powerful nanoparticles with significant research interest, but also substantial safety concerns. They have substantial safety concerns, right? Carbon nanotubes are cylindrical molecules of rolled graphene, right? 1 to 2 nanometers in diameter, up to a micrometer in size and length, right? Extraordinarily strong, right? Extraordinarily strong. And they've been tested with high electrical and thermal conductivity, right? This isn't FDA approved therapeutic applications, right? There are none, right, that exist, right? They do not exist, right? This is only research. They and the research areas are covered under drug delivery, biosensors, tissue engineering, scaffolds, right? And here's all the safety concerns, right? Biopersistent CNTs resist biological degradation, right? They have potential for toxicity. Some studies show respiratory toxicity resembling asbestos effects in animal models, right? And there's an accumulation effect, which they can accumulate in the liver, the spleen, and in lungs, right? And they also have inflammatory responses, right? Non-functionalized CNTs can trigger immune responses, right? And graphene oxide, right? Those are the GOs, the single atom thick carbon sheets with oxygen containing groups, high surface areas for drug loading, antibacterial properties. There is no FDA approved therapeutic applications. There are none, right? This is research only. And these applications and are used for biosensors for detecting biomarkers. They have antibacterial coatings. They can be used for drug delivery platforms, right? And that part is in preclinical phase, right? There are a huge number of safety concerns. Some of those safety concerns are toxicity, right? There's a toxicity profile still under investigation. Some studies show oxidative stress at high concentrations, and there's long-term biocompatibilities that are unclear as of right now, right? So while carbon-based nanomaterials offer extraordinary properties, significant safety hurdles remain before clinical translation. Claims of current medical use are premature. And here's my layman's block, right? Here's my layman's block. Carbon nanotubes and graphene oxide are super strong, right? Super thin materials made of carbon, stronger than steel, but microscopic. Scientists are excited about using them as sensors to detect disease or scaffolding to deliver certain drugs, right? But here's the big problem. They don't break down in your body, which means they could pile up in your organs and cause inflammation, similar to how asbestos damages lungs. Studies are mixed on whether they're safe, and right now, none of this is approved for medical use in humans. It's all still being researched and tested for safety. The potential is huge, but so are the safety questions. This is maybe in the future tech, not current medicine, right? So, excuse me. I do apologize for that, man. Now let's talk about nanoparticle clearance and safety, right? So, in understanding what happens to nanoparticles after they're injected is critical for assessing long-term safety. And here's some of the primary clearance pathways, right? you have to have renal clearance, and that's for your kidneys. Nanoparticles smaller than 5 to 6 nanometers can be filtered by your kidneys, right? Excreted in urine, right? But gold nanoparticles, which are small quantum dots, can clear this way if properly designed. I mean, we were talking about gold nanoparticles earlier, right? So, excuse me. Large nanoparticles take up liver macrophages, right? Processed and excreted through bile into intestines. Most lipid nanoparticles clear primarily through liver, right? And the immune cells throughout the body recognize and consume foreign particles, right? That reduce immune recognition and extend circulation time, right? And this is documented, right? Lipid nanoparticles generally biodegradable and are broken down by liposes, right? And they're broken down into natural fatty acids. They have extensive safety data from billions of vaccine doses. Short-term reactions that are well documented, that have long-term studies that are current and ongoing, right? And there's metallic nanoparticles, right, that can accumulate in liver and the spleen. Some biopersistence that are observed in animal studies have long-term effects being studied through clinical follow-up, right? Biodegradable materials are preferred, right? Size optimization for clearance and surface modifications to reduce toxicity, right? Dose minimization is important, right? The FDA requires comprehensive biodistribution and toxicity studies for all nanomedications, including long-term follow-up data and clinical trials. And here's my layman's block, right? Here's my layman's block. What happens to nanoparticles after they finish doing their job? If they're small enough, under about 5 nanometers, your kidneys can filter them out like any other waste, and you, lack of a better word, you pee them out. Bigger ones get eaten by immune cells in your liver and spleen, then expelled through your digestive system. The safest nanoparticles are made from materials your body can break down naturally, like liptides that turn into fatty acids or proteins that become amino acids. Metallic nanoparticles like gold and iron can stick around longer in your organs, which is why scientists study them carefully. The FDA requires companies to approve nanoparticles either clear out safely or don't cause harm if they stick around. It's like an environmental cleanup, right? You want to make sure nothing toxic accumulates, right? And here's the current landscape that's happening right now, right? Let's map the actual regulatory landscape for nanomedicines in the US, right? These are FDA-approved nanomedicines, right? Current treatments, you have Doxil, you have Exome, you have Abraxane, you have Marquibo, you have Onividide, you have Vixioses. And then for genetic diseases, you have Onpattro. For iron supplementation, you have Feraheme, right? And then you have your vaccines, which are your vaccines, right? I don't have to go through those vaccines, right? These are all FDA approved nanomedicines, right? Estimates range from 4 to 75 plus, right? Depending on classification criteria. This requires the FDA regulatory framework, right? And here's that framework for that. That's Nanotechnology Task Force, established in 2007. It's an and they're estimated updated guidance of documents for nanotechnology in 2017 and 2022. The requirements include comprehensive characterization of particle size, distribution, surface properties, preclinical toxicity and biodistribution studies, clinical trial phases 1 through 3, and long-term safety monitoring, right? But here's what's not approved. It's not approved for magnetic stirring. We talked about that. It's not approved for autonomous nanobots. We talked about that. It's not approved for DNA origami therapeutics. We talked about, and it's not approved for nano swimmers. We talked about, and it's not approved for photothermal gold nanoparticle therapies, right? We talked about that as well. And here's my layman's block. The FDA has approved dozens of nanoparticle medicines over the past 30 years, mostly for cancer treatment, genetic diseases, and vaccines. The COVID vaccines are the most widespread. Billions of people receive nanoparticle-based medicine. But here's what's important. The FDA has not approved the futuristic stuff like steerable nanobots, DNA origami treatments, or magnetic remote control systems. Those are still in research or trials. The approved nanoparticles are relatively simple, protective shells around drugs that help them get where they're going or where they need to go, right? It's like public transportation, right? That's what those nanoparticles use. Like they're like public transportation. As public transportation will get you safely from one point to another, right? That's what nanoparticles are like, right? The FDA has strict rules requiring years of testing to prove these are safe and effective before approval. Real nanoparticle medicine exists and works, but it's more basic than sci-fi, right? It's more basic than sci-fi, right? So, that's my layman's block for that, right? Now, let's talk about what's critical for my work, right? Let's talk about what's critical for my work, because understanding the difference between the research stages is what's important, right? The research stages explain one, basic research, right? And the basic research is testing in cells and petri dishes, proof of concept demonstrations, mechanism studies, not evidence of clinical viability, right? Preclinical research, right? Preclinical research is the animal models, right? Testing in mice, rats, or in larger animals. Toxicity and efficacy studies required before human trials. Not proof it works in humans. Many fail to translate, right? And the clinical trial phase, which is first in human studies, small groups, 20 to 100 participants. Primary goal is safety and dosing, not proof of effectiveness, right? And then you have your clinical trial phase 2, which is larger groups, 100 to 300 participants, right? And those are evaluated efficacies and for side effects. And some benefits are shown, but not conclusive, right? And then you have your clinical trial phase 3. Those are larger groups, right? 300 to 3,000 participants, and it compares to standard treatments. If successful, leads to FDA review. Strong evidence, but not yet approved, right? FDA approval are rigorous reviews of all data, manufacturing quality assessments, risk-benefit analysis, and only now is it proven for medicine use, right? And then you have your post-market surveillance. That's your phase 4, right? And that's your long-term safety monitoring after approval. And there are rare side effects that may emerge, but they are under continuous evaluation. And this is why this matters for Merger Wednesdays, because when researchers publish saying nanobots or nanorobots killed cancer in mice, that's phase 2, preclinical. It might take 10 years and fail at any stage before becoming approved medicine, right? Then there are red flags for exaggerated claims, right? Science is discovered. Research stage. When they say science is discovered, that's in the research stage, not the clinical stage. Understand the distinction, right? And then when they say studies show, that these two that's for petri dishes, right? Mice, and you need to understand that part, right? And could treat. That's speculation, not evidence, right? So you have to understand the words, man. Words have meaning, words have power, right? Shout out to you know who for that one. And in trials, right? In trials means being tested, not proven. And for my doctoral standard, I always have to identify the stage of research and never present early research as established medicine. That's why I have to break it down and give you the distinction. And here's my layman's block for that. Here's how medicine actually gets from lab to patient, right? First, scientists test in cells and dishes, then in mice, then in small groups of humans for safety, then bigger groups for effectiveness, then massive studies comparing it to current treatments. Then the FDA reviews everything. Then it's approved. They then monitor it for years for rare problems. The whole process can take anywhere between 10 to 15 years, and most candidates fail somewhere along the way. When you hear scientists discovered robots that cure cancer, check what stage it's at, right? If it's in mice, it's decades from doctor's office use, right? If it ever even makes it. So that's an understanding you need to understand. The media hypes early research like it's a cure tomorrow. Your job is to be precise about what stage everything is at when you hear these things, right? Don't confuse promise or promising research with proven medicine. Now, we're coming to the end. We're coming to the end, people. So let's synthesize what we know with certainty versus what remains aspirational, right? Here's verified reality. This is what exists right now, right? FDA approved billions of doses administered vaccines, right? Through lipid nanoparticles, right? Cancer nanomedicines have multiple FDA approved formulations, right? We discussed that. Iron nanoparticles that are FDA approved are for anemia treatments, right? And used in contrast agents. Albumin nanoparticles are FDA approved cancer treatments, right? And their safety protocols, right? FDA regulatory frameworks that are required for all of these and testings, right? And this is where your active research lies, right? The gold nanoparticles are active research. The magnetic hypothermia treatments are active research. The bacterial phophagy therapies are for emergency use only, not approved as standard treatment. And here's what's in the possible future. These are future possibilities, right? The DNA nanorobots are future. Nano swimmers, future. Magnetic steering, future. Enzyme powered nanomotors, future. Biohybrid systems are in the early research phase, right? So for the merge, right? The merge content and context, the integration of these technologies and biology is happening through nanoparticles, but is more subtle than sci-fi suggests. You're not getting steerable nanorobots piloted by doctors yet. You're getting drug delivery systems that exploit biological pathways to reach targets more effectively. The verified technologies are transformative, but not yet sentient, right? Not autonomous, and not externally controlled in real time. There's sophisticated chemistry taking advantage of biology. And for my researchers out there, right? Stick to FDA-approved technologies, and clearly defined clinical trial stages. Cite cite properly, right? Distinguish between demonstrated in mice and available to patients. Your credibility, for my researchers, your credibility depends on precision, right? That's the verified reality. And that is powerful enough without exaggeration. And here's my layman's block. Here's my layman's block, right? Because here's the bottom line. Medical nanoparticles are real, and billions of people have received them. FDA-approved nanoparticle medicines for cancer, genetic diseases, and vaccines are used daily in hospitals worldwide. That's not hype. That's documented fact. The futuristic stuff, right? Robots you can steer with magnets, DNA machines that can hunt cancer, self-swimming nanorobots that's still being researched, tested in animals or in early human trials. Some of it will probably work eventually. Some will fail. None of it is standard medicine yet. The merge is happening, but it's through proven chemistry, not sci-fi nanorobots. And for my researchers, cite the FDA database. Search clinical trial registries. Verify every claim, right? The truth is impressive enough. You don't need to embellish it. And for some of the sources that are verified for tonight's episodes, these are some of the sources. Make sure you go look up your FDA drug database, right? Right. Their clinical trials at clinicaltrials.gov. Their publications at PubMed, right? PubMed. And here's another publication, Nature by Biotechnology, 2018 DNA nanorobot studies, right? And then you have FDA nanotechnology resources at fda.gov, right? In closing, right? In closing, because this is the end of the show, man. I enjoy teaching you guys yet again, right? This episode, which is episode number 179 or merger number 7, is verified and rebuilt, right? Verified and rebuilt, man. And what I mean by rebuilt is that you have to understand about the process of what I said in the beginning: destroy and rebuild. We're going from the reckoning to the rebirth, from season 3 to season 4. Season 3 is the reckoning, that's the destroy. Season 4 is the rebuild, that's the rebirth, right? Every claim made tonight can be fact checked. Every technology is identified by its actual regulatory status. Every future possibility is labeled as research, not reality. This is how you build. I'm showing you guys, man. This is how you build a doctoral foundation, right? With verified sources, honest distinctions between research stages, and zero tolerance for exaggerations. The merge is real. The science is powerful, but precision is non-negotiable. Look, drop your thoughts, man. Drop your thoughts. Share with someone who needs verified information. And remember, truth doesn't embellish. Truth doesn't need embellishment when it's transformative, right? And listen, next Wednesday for episode 8, we're going to do the exact same thing with the same rigorous standards, right? And to my final bosses, to my smarts, to my motivators, to my warriors, this has been Merger Wednesdays. We're here each and every Wednesday at 9 p.m. This is the Final Boss Podcast. I am the one and only, the Final Boss, right? We are here. I am here. And if this information resonated, share it with 3 others, man. Go share the information with 3 others. Let it marinate in your spine. And always remember this distinction, right? There's a heavy pain that comes with discipline, but the pain of regret is even heavier, right? And to all of you out there, thank you again for joining us. That is our show for tonight. And remember these things. Good morning, good afternoon, good evening, and good night. Be balanced, be equal, and be smart. That is our show, ladies and gentlemen. Thank you for joining us. I hope you took great notes, and if you have some questions, man, shoot me a DM, shoot me a DM, shoot me an email. The email is at info@thefinalbosspodcast.com, or you could drop comments or what have you, or send us messages on whatever platform you see us on. But that's been our show, man, and it has been great. Thank you for joining us. More conversations about the merge is coming soon. See you next week.